Good day, everyone. My name is Daniel, and I am from CareConnect Innovators Group. Imagine living hours away from the nearest clinic without a smartphone, no money for airtime, but still needing daily medication or urgent medical advice. Now, imagine accessing critical healthcare services by only using a basic phone and a simple code. Today, we want to show you how our solution, CareConnect, can help bridge the healthcare gap in rural South Africa through a USSD-based system that requires no data, no smartphone, and speaks your language. We will walk you through the real-world problem solving, how our USSD solution works, the impact it's already making during the testing, and how your support can help scale this innovation to reach thousands more. By backing CareConnect, you are enabling real life-saving change for people who've been excluded from digital healthcare while contributing to a scalable, affordable tech solution that deeply rooted in community needs. Technology should serve everyone, not just those with smartphones and Wi-Fi. CareConnect empowers underserved communities to manage their health through accessible mobile tech. Here's what we will cover. So, in the slide by slide, we will be looking at the problem statement, the user personas, key pain points for our users, the overview of the solution, how it works, that is your user flow, the wireframe that we tested with our users, the feedback, KPIs, scalability, and the team behind all the success of CareConnect, as well as the action that we're looking to get to. So with that being said, starting with our problem statement, healthcare healthcare in rural South African is broken. We have elderly people walking long distances. We have poor infrastructure. No access to medical information leads to preventable death. So the problem is healthcare in these areas is deeply unequal. Elderly people, pregnant women, children are the most vulnerable ones. And then we met with our two user personas at users, whereby Masichaba Mulife, who's a farm worker, lives miles away from the clinic. He has no access to smartphone or even mobile data. So it is a problem for her to actually be able to access the clinic other than walking that long distance to the clinic. Also, Maria Mokwena, who regularly goes for checkups, who also struggles to refill the medication on time due to long queues, long distance to the clinic. She is one of the elderly diabetic and has no access to a smartphone nor a mobile data. And with that, the key points that we had, which is the problems that we had on that, which is key pain points. When we interview them, we found that many people have common pain points. Mainly, we're looking at a lot of people in the rural areas do not own smartphones and they do not have Wi-Fi, no data, because they look at that. I mean, why would you need data for a non-Android phone? So they're using basic phones, and then also it's also digital literacy, which is most of them they not so much. Literate into your Android phone or your smartphones. And then we also have a big issue with language. English being one of the biggest problems. Yes, they can speak English. However, most of them are onto the vernacular languages, which is your Zulu, your Xhosa, Sotho, Tswana, Swati, and many more of those. So our solution for CareConnect was the USSD platform. So we built a USSD platform, a mobile health solution, accessible from any basic phone, no airtime needed, no app required. It is an inclusive healthcare tool accessed via USSD. For example, you'll be dialing one star 134 star 1234 hash, which will then give you features. You can register on that USSD, register your details, which will be linked to the clinics or hospitals or healthcare organizations around your area. It will also give you the closest clinic to you when you go into that. It will give you consultations if you have registers, your vital signs, medical reminders. Also, there is health education onto that as well. We then went, when we tested our wireframe with the USSD, by dialing star 134 star 1234 hash. It then gives you the few steps that you need to follow. Firstly, by registering or signing up. Secondly, it also gives you languages, different languages as requested. You follow the prompts, which also it's something as CareConnect will be also doing when we launch it. That is teaching users how to be able to use it. All right. So you can book a consultation, order a medication, and check the nearest clinic, which is a clinic finder, learn about the chronic disease around and all those things that you would want to use the wireframe for. And on that, as well, we also included an emergency shortcut based on our user feedback. We found that because of the clinics are a little bit more far from where the user stays or people in the rural area stays, you'd find that it is a problem mainly when it comes to emergency. There isn't any help in terms of an emergency number. No one knows what to dial or what to do if in the middle of the night an elderly person is sick. So we've also added an emergency shortcut, which is just pressing 9, you can reach help quickly. It's something that also will be implemented, integrated into the app, into the USSD, whereby the clinics or the hospitals will have a dedicated person that will then work alongside this USSD information. And then the impact that we're looking for, the language features, we also, based on the users, we are now adding more vernacular languages. For example, isiZulu, Setswana, isiXhosa, isiSwati, Tshivenda, and more of the languages to support the users with low literacy. Now, the impact goals is that in 3 months, we aim to register 500 plus users to maintain 80% successful consultation flows and at least send 100 plus reminders. So now with the reminders, we're then talking about users who have registered onto the USSD, and meaning that being integrated into the clinic, and also this have an integration, we want to combat medication reminders, whereby we want to see how the reminders will work, and then out of that, if we implement this for the first 3 months, we are going to put in more care, more looking more into it, and then out of those new onboarded users, we also need to increase it as time goes, including the successful consultation, including the successful medication reminders, and the number of people that have been added. Now, as mentioned during the slide, partnership and scalability. We are ready to partner with mobile networks, health mobile networks, and clinics across South Africa to reach even more people. Now, with that being said, for the USSD to actually be to work, we need to collaborate with or partner with this networks and clinics, so that we have a dedicated person that will actually be able to look into this messages as they come in. Message reminders will be locked into your USSD. You'll get the reminder every now and then once you have registered onto the USSD. And then also in terms of the closest clinics, you will also have someone that will be dedicated into that clinic to actually help you with regards to small things as vital checking, small things as to what's your next appointment, consultation, and many more. Now, in the next slide, we do have a CareConnect Innovators team, whereby myself, Daniel P4, project manager, and also assisted on the data analyst. We do have Cindy Siwekubega, who is a product manager, also assisted on the UI UX design, the wireframe assistance. Walter Shakudi, the UX UI designer, also was doing a research, which is UX researcher. And lastly, we do have our dedicated data analyst, which is Ranzu Novella, who also assisted into the UX research of the project from the beginning. Now, with that being said, what we need as a team to take CareConnect further, we need to support, we need your support to scale across 3 provinces and launch our wireframe. Now, when we're saying 3 provinces, we're looking at Limpopo, rural. We're looking at Eastern Cape, rural. We're also looking at Free State in the rural. All right. Funding to expand to at least 3 more provinces, build our pilot through those clinics, and then also partnering with those clinics around those areas to be able to get to our target and also to make sure that our wireframe is working perfectly. And then now, the call to action. This is very touchy with CareConnect. Most of us are from the rural areas, so when we say this, we say it because we really mean it. We've seen how this have been in the past. So we're saying if healthcare is a human right, then CareConnect is how we make that right real. No matter where you live or what phone you use, let's build the bridge together. CareConnect. So with that being said, thank you very much for sitting in, and we really appreciate listening. I will take any questions should there be any questions. Thank you.